Hello, I'm sitting here with Dr. Sinatra. He's renowned about this metabolic cardiology concept, and he's helped a lot of people worldwide. And I think it's important for you to know what the concept metabolic cardiology is all about. So I want to ask you, Dr. Sinatra, what's it all about? What do people need to know about metabolic cardiology?
Well, I'll tell you, Tim, metabolic cardiology is about driving energy in a preferential direction. So you can use targeted nutritional supplements that support ATP, which is adenosine triphosphate. Our cells make it, but if you take supplements, our cells can make it even more rapidly. And when you make ATP, ATP is the energy of life. You know, the Chinese call it qi, the Japanese call it kai, the Hebrews and the Christians call it breath of God. But it's our vital energy, it's our vital force. And whenever you drive ATP in a direction, not only will it give you more energy, but after reading an article in Science in 2009, Scandinavian researchers suggested that you can actually get cardiomyocyte renewal in your heart. In other words, you can build new heart cells. Mm-hmm. And in the age that we're in now of stem cells and everything else, could metabolic cardiology actually drive your intrinsic stem cells into a situation of rebuilding, possibly even new cells in the heart? And that's what I saw in my clinical practice with metabolic cardiology. I saw people who had massive heart attacks, congenital heart disease in children, and all of a sudden with metabolic cardiology, and I couldn't explain it why. I couldn't understand why they're living 5 years, 10 years, 15, 20 years. I'm saying, what's going on here? Yeah. And yet, what I believe what metabolic cardiology is doing is it's resurrecting our own intrinsic stem cell renewal or repair, so we're building new cells in the heart. Amazing stuff.
Wow. So, can you tell me why people with heart failure need more ATP, need the mitochondrial stimulation, or making the ATP production in the heart cells? Why it's so important for the heart cells to make ATP?
Well, heart cells need energy, and remember, ATP is really our energy. And this is amazing, but in our biceps, we only have like 200 mitochondria per cell. But in a heart cell, we have 5,000.
Oh, wow.
So it's amazing. So, I mean, the entire weight of the heart, about 1/3 of the weight of the heart, the size of your heart is about the size of your fist, right? So 1/3 of that is mitochondria. So it makes sense. In other words, if you can feed the mitochondria with CoQ10, carnitine, L-carnitine, D-ribose, and magnesium, you give like food to the mitochondria. You build energy into the mitochondria, and the mitochondria make ATP, and there's something magical about ATP. And again, I believe it intersects with the intrinsic stem cell renewal in the body, so I really feel it's important.
So what's the difference between the medication, people with heart failure, for example, they take a lot of medication? What's the difference between the medication people use and the metabolic cardiology approach?
Well, a lot of people use medications. I mean, let's face it, if a person can't breathe, they're in serious heart failure, sure they'll need medication. And you have to do the right thing for your patient. But remember, medications will take care of symptoms. Metabolic cardiology gets at cause and effect. And I mean, I am amazed what metabolic cardiology has done. I did an interview for Brazilian television only about 2 weeks ago here in Florida, in Tampa. And the interviewer came out because his 15-year-old daughter never had surgery for what we call tetralogy of Fallot, which is a devastating congenital condition. And he came up and interviewed me, and the interview was in Portuguese. Because he believed that, and his cardiologist believed that metabolic cardiology saved his daughter. So in my practice, I've had dozens and dozens of patients who needed heart transplants and refused heart transplant because of metabolic cardiology. And I'll tell you, Tim, I never put that piece together until I read this article in Science in 2009, and another article came out in 2017. But again, there's something magical about ATP. I don't know what step it's doing in invigorating stem cell repair, our own intrinsic. Because remember, our own stem cells have the wisdom. They have the wisdom and the knowledge to repair the body. So there's something going on, and I got the chill on that. So that's the angelic chill. So I think the angels want me to say this. So and by the way, in my book, Health Revelations from Heaven, when I met Tommy Rosa, who went to heaven and back, I asked Tommy. I said, "Did you hear about metabolic cardiology in heaven?" He says, "Absolutely." He heard the whole mitochondrial story. So mitochondrial medicine, I think, is going to be the medicine of the future. Anti-aging medicine.
So, can you tell me something more about ATP in the heart? Does the heart store ATP, for example?
Well, the heart, because it has the most mitochondria in the body per cell, actually, the heart is the organ that does the most work. In other words, it's always pulsating. It never stops beating. It beats, what does it beat, like over 100,000 times in a day, for example. It's incredible. With the heart always beating and never resting, it requires more ATP. The kidney requires a lot of ATP, the brain a lot of ATP, the liver. But the heart is the most, magical in its utilization of ATP. So it just makes sense. With heart failure, you need to give precursors of ATP. And that's where metabolic cardiology comes in. You're giving Q10, carnitine, D-ribose, magnesium, which build, ATP. And remember this, there's been biopsies on hearts, where they take a piece of the heart out in people with florid heart failure. And it shows diminished ATP in the heart cells. So if the heart cells are starving for ATP, what we need to do is just give it what it needs, fertilize the heart. That's how metabolic cardiology works.
Sounds very logical.
Oh yeah, it's very, very logical.
So in our clinic in the Netherlands, I read your books a few years ago, and my German colleague told me to look into your work. And from 2011 we are treating patients with heart failure with your protocols like coenzyme Q10, D-ribose, magnesium, L-carnitine of course. And we also did it with IVs of those substances. What do you think about that? Did you ever heard about that before?
You give an IV CoQ10?
IVs, L-carnitine and taurine, all the substances to make.
Oh, that's okay. I mean, you can give it by mouth, or if the people are very, very sick, you can give it IV. IV magnesium is magical. I mean, in my career, I used IV magnesium to treat complex cardiac arrhythmias. And it just makes sense. And we can use magnesium for treating high blood pressure. It causes vasodilation in the blood vessel wall. It supports the cell. But again, magnesium is one of the elements that's involved in over 300 enzymatic reactions. And magnesium, in the presence of ribose, and the body makes ribose. But again, if you're so drained of energy, like in heart failure is energy-starved heart. And you must give that heart back energy, and the way to give energy is ribose, or the whole metabolic cardiology concept.
So, can you explain to people who are watching this, why there are doctors not telling them about the metabolic cardiology?
Well, I mean, more and more doctors are getting it, there's no drugs that I know of that build intrinsic stem cell repair in the heart. And look, I stumbled upon this by accident. This is something that has taken me 40 years to learn. I mean, I started using CoQ10 in 1982, and 15 years later, I used the carnitines with it. I've always used magnesium. And then in 2004, I was at a lecture in Las Vegas, and that's only, 14 years ago, when I heard Dr. Roberts, and I asked Dr. Roberts to write a book with me into that, and we wrote Reverse Heart Disease Now. But then when he talked about D-ribose, I said, my God, that's the missing link. That was the missing link I was searching for years. But when he told me about D-ribose, I called up Jim and I said, Jim, would you write a book with me on metabolic cardiology, or at least do the introduction? He said, I'll do the introduction, I'll be happy to. And then after that, we wrote a book together. So I just feel that more and more cardiologists are learning about metabolic cardiology. It just makes perfect sense. It's going to take a while, maybe another 10 years for the conventional medical establishment to make it mainstream, but I think someday it'll be mainstream.
Okay. Thank you very much. Because of your
Great interview.
Yeah, because of your books and the things I learned from you, we helped a lot of people. We did reversals of heart failure. What people say it's not possible.
I know, it's amazing. I mean, it touches my heart because when you can take a very, very sick person on the brink of a heart transplant and bring them back, I mean, that's really rewarding.
Yeah. So thank you for sharing your knowledge. Thank you for this interview, and hope to see you soon.
All right, great.